Do you feel like you always have a urinary tract infection and urinary tract infections are ruling your life and your routine on a daily or weekly basis is dictated based on whether you're getting a urinary tract infection or not? If so, stay tuned. We're going to talk about some UTI prevention strategies, some things you can do at home, and some things we recommend as urologists. Hey guys, Dr. Segal here. So the question is, UTIs are ruling my life. Help. What can I do to stop them? So this is super common referral that we get from primary care doctors trying to help patients that get frequent UTIs. At the end, we're going to talk about something that is simple, but you can employ tomorrow to try to make it so you're not getting as many urinary tract infections as you have been. So the first thing I want to tell you is this is super common. 60% of women in their lifetime will suffer from a urinary tract infection. And often the ones that get one urinary tract infection are going to get them again and again because the same factors that made them get one UTI make them keep getting urinary tract infections. So, I always try to tell people you are not alone with this. This is a very common problem and we see this all the time. One of the concepts for preventing urinary tract infection is trying to change the pH in the bladder. Bacteria prefer alkaline environments in the bladder. They don't like acidic environments in the bladder. To that end, we take steps to try to make it so the urine is more acidic in the bladder so bacteria is less likely to live there. Vitamin C is an over-the-counter supplement that you can take and acidify your urine. So that's one thing, something simple, something you can pick up at your drugstore tomorrow and hopefully make it so you're getting less urinary tract infections. There are other medications. Hiprex, Hiprex, also known as methanamine, is a medication that individuals take once or twice daily, and that can make their urine more acidic. When it's more acidic, less bacteria live in there, and you'll get less urinary tract infections. That's something that needs to be prescribed, so you can discuss that with your primary care doctor, your urologist. Also, so that's a way to change the pH in the urinary tract so bacteria is less likely to live there. Bacteria have these structures called fimbriae, right? And these are little tentacles that they have that make it so they can stick to the lining of the let's say this is a bacteria, stick to the lining of the bladder. And when they can stick there, then they can cause urinary tract infections because they're not going anywhere. They're going to be stuck there like Scotch tape on there. So there are certain supplements, there are certain foods that have what I would like to call anti-sticking properties, can make it so these fimbriae don't stick onto the lining of the bladder, and then these bacteria are urinated out when a patient voids or empties their bladder. Some of the examples of this are unsweetened cranberry juice, cranberries, blueberries. There's a sugar called D-mannose, which is found in some of these foods. And that can actually be a supplement that you take separately, which again makes it so these fimbriae do not stick to the lining of the bladder. So that's the next concept. Either medications, supplements, or foods like cranberry, unsweetened cranberry juice that prevent the bacteria from sticking to the lining of the bladder. D-mannose is also found in apples, oranges, peaches, broccoli, all sorts of stuff. I mean, you can Google it and find out. So there's a lot of natural dietary changes you can make to create an environment that's inhospitable for bacteria to stick to the lining of your bladder. Going along with the concept of acidification, there is an intravaginal estrogen cream that prescribers can give patients. Premarin is an example of this, where they apply it to the inside of the vaginal canal. This will acidify the environment in the vaginal canal. Bacteria is less likely to reside there. And then that bacteria is less likely to what we call reflux or go into the urinary tract. Vaginal canal sits right behind the urethra. So the urethra is pretty short in women as compared to men. So if there's bacteria in the vaginal canal, it can go into the urethra and then cause a urinary tract infection. But if we can acidify the environment in the vaginal canal, then it's less likely that this bacteria is going to inhabit there and less likely that it's going to go into the urinary tract. Now, there's some people that aren't a candidate for estrogen cream, but your prescriber can talk to you about that. There are kind of targeted antibiotic regimens that we can try. Chronic antibiotic therapy is problematic because it can breed resistance, but we've had patients that have success with what we call pericoital prophylaxis, which means that you're taking antibiotics just for a couple doses around the time of sexual activity, because that bacteria that would go from the vaginal canal into the urinary tract, that's going to happen after sex. And if we can sterilize the urine prophylactically beforehand with antibiotics, then that's less likely to result in a clinically significant urinary tract infection. Also, another strategy that we use for kind of targeted antibiotic therapy is sometimes we'll give patients an abundant supply of antibiotics and tell them not to use it unless they notice the first sign or symptoms of a urinary tract infection, and they can take it for 3 days only at the first sign of a urinary tract infection. That can sometimes break the cycle of them getting so many urinary tract infections. And when they get them, they can go away more quickly. So we kind of call that on-demand antibiotic prophylaxis. These things don't work for everybody, but these are strategies that have worked in the past. After sexual activity, make sure you empty your bladder, okay? Because if there's bacteria that's refluxed into the urinary tract, if you empty your bladder, that bacteria is going to get out, okay? Something simple, you want to wipe front to back, not back to front. That's important so that you're not getting bacteria from the GI tract into the urinary tract. So those are some tips that we typically give for people that are prescription and not prescription for ways you can get less urinary tract infections. And sometimes we employ a combination of all those things, especially for individuals where one's not cutting the mustard and we need to do more to get them to have less urinary tract infections. And then this is my tip. This is my pearl at the end. And this is something very simple, but I think it's extremely effective. Increase your hydration, okay? So I tell people you should try to aim for a urine color that's relatively pale. I usually tell my UTI patients, get a jug of water, fill it up during the course of the day, just sip on it. It's going to keep your urine dilute. It's going to make it so that if there is bacteria in there, because some people, it's unavoidable. Bacteria is going to stay in there. If that bacteria is in there, it's going to get flushed out because you're going to be peeing so frequently, which can be an inconvenience, but in general, it's a healthy thing to do. One of my favorite professors, when we were training, talked about this study that they would never do now. It was done 100 years ago. They had medical students, and half of them, they put bacteria in their bladder, they inoculated them. The other half, they put bacteria in their bladder, they inoculated them. One half, they just had them drink tons of water. The other half, they gave antibiotics. And guess which one cleared the bacteria first? The ones that stayed hydrated. So that's super important. A behavioral way to employ that is to just sip on water all day and bring a jug with you. So hopefully that gives you some strategies, things that you can do at home, things that you can bring up with your healthcare provider about how you can prevent urinary tract infections. You may need a combination of all those things, but I hope that's helpful to you. Thank you so much for listening. We appreciate it. Please subscribe to our channel.